Hi, I'm Sarah Blair, dentist and co-founder of Indie Practices. At Indie Practices, we love to coach on systems, and one of the most important ones is making sure that your entire team can successfully answer a new patient phone call and get that caller into the schedule. In the notes below, you'll see a link to an important document that has some more great information. And I recommend that you watch this video at the start of a team meeting, have the document ready beforehand to share with your team, and then discuss. It's really important that even the dentist and the hygienist can successfully answer a new patient phone call. The first step is to actually answer the phone. A huge number of calls are missed even during business hours. So if you're not tracking this, you might be missing more than you think. If a patient doesn't reach somebody on the phone, they will very unlikely leave a message or call back. They've already moved on to the next dental practice. It's also important to agree as a team how you will answer the phone. It could sound something like this. Hi, this is Riverside Dentistry. This is Sarah. How can I help you? In the next step, most team members fall into the trap of trying to directly answer the patient's initial question, which could be, do you take my insurance? How much is a crown? Simple questions that often lead to a dead-end conversation. So it's really important to take control of the call. And I like to do this by saying something like, oh, thank you for asking that. Do you mind if I ask you a few more questions so I can better help you? And then you can lead into something like, oh, did you hear from another office that you need a crown? Tell me more about that. Or most PPO plans can be used at any dental practice. We have a lot of patients with that plan. I'm happy to help you with that. And other questions to get some more information, like, are you just hoping for an exam and cleaning, or do you have another concern about your teeth today that you'd like us to look at? And tell me more about that is always a great question. So take control of the call and don't let yourself get painted into a corner by just directly answering yes or no questions, because ultimately the call will end and you will not get the patient to schedule. Many patients who are calling are in pain, they're uncomfortable, or they're really stressed out about having to make a dental appointment. So it's really important that we show empathy and that we connect with the patient in a warm and friendly way over the phone. So when you hear a patient say something like, I've had a toothache for 5 days, don't just say, okay, let's get you scheduled. Show some kindness and empathy by saying something like, oh my gosh, I'm so sorry to hear that. That must be really uncomfortable. So show that you care over the phone. It'll really go a long way to creating a connection with that patient. Next, it's important to build value and really talk up your team in your practice. Some great things to say are, well, you definitely called the right place. We can totally help you with that. Or Dr. Smith is so good with kids, you're gonna love her. Or say something about the hygiene team. They're all just so friendly and gentle, you're gonna love them. And you really just wanna build confidence in the patient that they've made the right decision, that they wanna come to this appointment, and that you're going to be able to help. Remember, the overall goal of the call is to end with a scheduled appointment. Be confident. The patient called you for a reason. Say, let's get you set up. Would Tuesday at 10 a.m. or Thursday at 2 p.m. be better? If neither one of those work, offer what days and times work best for you, and then give them 2 more choices. Ask, are there any other family members that need to see a dentist? I really recommend following the script that you'll see at the end of our document every time, every call. This will ensure that you don't miss anything and that we're consistent on each call. It's great to hear all this information, but it's even better to actually practice. After your team has watched this video together, I recommend pairing up and practicing the language until it sounds natural and smooth. Remember, the goal of every new patient phone call is to end the call with a scheduled appointment. Thanks for letting Indie Practices be a part of your team meeting, and have a great day.